Let us recap our top stories once again this hour. The Deputy Finance Minister, David Masondo, says he will subject himself to ANC internal processes. This is the ANC's NEC considers a recommendation that he step aside over a report of an extramarital affair. South Africa has recorded 193 new COVID-19 related deaths. This brings the total number to 8,005. Police had to use water cannons, rubber bullets and tear gas to disperse protesters in Kraaifontein outside Cape Town. A woman remains in critical condition in hospital after having contracted COVID-19. She has accused her employer, the Department of Public Works, of refusing to allow her to work from home. She has a history of lung-related illnesses, and now her union has entered the fray, also accusing the department of failing to follow COVID-19 occupational health and safety protocols in the workplace. So far, 12 employees at the Department of Public Works head office have tested positive for COVID-19.
The union was alerted to the increasing number of COVID infections at the head office. There was a battle to have the building shut down for fumigation. The Public Servants Association says the lives of employees has been compromised.
We have contacted each and every single minister within the public service to also inquire of them whether they are complying with the regulations. So if somebody does find themselves in a situation where they are being abused, where there's abuse by the manager or whatever the case may be, they have every right to go to a doctor to get a doctor's note to prove that they actually are not feeling well. And if things still do not change, they can then contact their union.
They've called on the Chief Health Inspector in Gauteng to intervene after finding out that an employee who was forced to work from the office is now critically ill as a result of having contracted the coronavirus.
We are very appalled. We are actually in shock about the allegations that we have received that a senior manager in the Department of Public Works insisted that somebody who has a history of pneumonia should come to work and should continue to work. We are appalled by that, and we find that to be extremely disturbing. If they experience that their manager is mistreating them and that their manager is bullying them and that their manager is not willing to listen to them and listen to their concerns regarding any issues that they are raising relating to their health, then that person by all means can lodge a grievance.
The employee's family has been left reeling as their loved one fights for her life in hospital, in ICU, on a ventilator. They also blame her employer for refusing to allow her to work from home despite the fact that she had underlying illnesses. Her spouse says he wants recourse for his partner, but fears further victimization being meted out against the family.
There was a time when she did lodge a grievance against one of the managers. It was an issue relating to unfair treatment, discrimination, bullying, etc., sidelining and non-allocation of work. It's quite difficult to be able to try and comfort the young children because they do see now that this thing is real.
Chief Inspector for the Department of Labour says legislation allows for vulnerable workers to work from home. He has cautioned that employers could be held liable if a vulnerable staff member falls ill or dies.
Vulnerable workers, as defined by the direction, which also refers you to the Department of Health guidelines, is any person with a known or disclosed health issue or with comorbidities or any other condition that may place the employee at a high risk of complication or death than any other employee if infected with COVID-19, or they may be above the age of 60 years. And therefore is possibly at a higher risk of infection. Now, the relevance of this cannot be underplayed.
In a written response to the SABC, the Department of Public Works has denied the allegations and says they'll be investigating the matter. Meanwhile, the manager in question has since provided a report to the Director General, who is to give a report back on the matter in the near future. Nozintombi Mia, SABC News, Johannesburg.
Health services in the Eastern Cape are under pressure, but the province has not run out of beds yet. That's according to the Eastern Cape government, which has dismissed news reports that it needs to send COVID-19 patients to hospitals in neighbouring provinces.
The Eastern Cape government says it has already completed 25 health infrastructure refurbishment projects. This means an additional 518 beds. The province also has a coronavirus recovery rate of more than 80%. But the province has made provision for residents to cross borders if a medical facility in a neighbouring province is closer.
Does not necessarily mean that the Eastern Cape and its facilities are overwhelmed, no. But rather on the basis of the spatial planning that has been there on the provision of facilities. Some facilities, as they are in the border, are closer that side than being into the Eastern Cape. A person, for instance, who would take 30 kilometers to get to a facility and still take 5 kilometers to get to a hospital.
The St. Barnabas Hospital in Libode has also been building a good track record in dealing with the virus. The hospital received PPEs today as part of ramping up PPE distribution before the expected peak.
It has actually been one of the hospitals in this area that has been a beacon of hope on the issues of COVID-19. And secondly, coming at this time, it became the best opportunity to come to also demystify the issue of that is always bragged about, that the Eastern Cape has a challenge with PPEs.
Insufficient PPE supplies have been at the center of numerous labor issues in the health department.
We have been prioritized by the Department of Health because we were the first institution here in the district to admit patients that were COVID positive. So that took us to another level in terms of being prioritized, and we had a great number of patients that were coming in and out. And as an institution that has got a large number of beds, we were admitting patients that were even coming from other areas within the sub-district, that is your Port St. John's area, your KST area, and the Mhlonhlo area, besides the Nyandeni patients that we've been managing. So now that we're getting this PPE from the Office of the MEC, we are going to have a large number of PPE, and we have got an influx of patients that are coming in and out of the institution.
COVID-19 have claimed at least 1,700 lives in the province. Lwandi Lembulali, Libode in the Eastern Cape.